This is a Jet 24, Fox 66, your Erie.com special report.
Good afternoon. We interrupt our programming to bring you the daily special report, an update on the spread of COVID-19 in Erie County. As she does every day, Erie County Executive Kathy Dahlkemper breaking down the numbers, letting us know about the increase in cases. That number ticked up a bit last week with higher numbers, but we've also had days with fewer numbers. So now let's go live to the studios of WQLN to find out the latest.
COVID-19 in Erie County. Today we have 2 new positive cases of COVID-19 to report in Erie County. One of these individuals is in their 20s and the other is in their 50s, and they reside in Zone 1 and Zone 3, which will be posted on the cumulative case map by zone at eriecountypa.gov. The numbers today take us to 145 cumulative positives with 3,278 negatives, and we have 120 recovered cases. An update on surrounding counties shows us Crawford County with 21 cases, McKean reporting 11 cases and 1 death, Venango County has 8 cases, and Warren County remains at 2 cases. Chautauqua County has 53 cases and 4 deaths, and Ashtabula County now has 232 cases and 26 deaths. The state is reporting 63,666 cases, 4,624 deaths. So again, please wear your mask when you go out and around people who don't live with you in your home. Keep that 6-foot physical distance from each individual that does not live with you also. Wash your hands frequently for at least 20 seconds with soap and water, and sanitize surfaces regularly. And use hand sanitizer when you're not able to get to a sink and wash your hands. Families across Pennsylvania, as we know, are experiencing unexpected hardships and unemployment loss. Yesterday, National Fuel announced a new crisis recovery grant program called LIHEAP, or Low Income Home Energy Assistance Program, which has been opened in response to the COVID-19 pandemic. This is a federally funded program that provides financial heating assistance to customers who qualify. A crisis grant can help you pay your heating bills. Criteria is based on your household size and income. So customers can contact either their local county assistance office to apply, or you can find more information at dhs.pa.gov/services/assistance. That's dhs.pa.gov/services/assistance. And this program will remain open until August 31st of 2020 or until the funds are depleted. And that brings me today to our star players, the model businesses that we want to highlight who are doing things well in light of the COVID-19 pandemic guidelines. First, Room 33. At 11th and State, they have everything pre-packaged and will bring it out to your car, or you can pop in and get the meal after you have called your order in. And also in the downtown region, we have French Street Farms on French Street. They are offering Victory Garden starter packs and provide the public the opportunity to purchase packages of 8 vegetable plants to donate to someone who is interested in gardening and may not be able to purchase the plants themselves, so you can buy some for yourselves or treat someone else to them. They are providing scheduled pickups of plants this weekend and have offered contactless delivery by just placing the plants in the trunk or the back of your vehicle. So thank you to these star players for helping us reopen Erie County safely, keeping our residents safe as well as the employees who work for them. And now, speaking of businesses, I want to bring forward David George. I welcome him with me today. He is a supervisor of environmental health services at the Erie County Department of Health and has been on the front lines of this pandemic fight since the beginning. David?
Thank you, County Executive. Since March 16th, the Environmental Division has been hard at work to ensure the safety of business employees and the patrons of these businesses. On May 8th, Erie County transitioned into the yellow phase, allowing more businesses to resume in-person operations. These businesses must make their employees and customers aware of the efforts and commitments to protecting their health and safety. Each business should have this COVID-19 safety procedures for businesses flyer and post it near the entrance for public view. This flyer must be signed by the Pandemic Safety Officer and management. The Pandemic Safety Officer is the one in charge of enforcing these protocols. Our team has followed up with businesses that have had a confirmed COVID-19 case to make sure that all state guidelines are being followed. With the transition to the yellow phase, the Environmental Division is starting to resume some of our normal operations. With construction resuming, our sewage enforcement officers are now reviewing permits and inspecting the installation of on-lot septic systems. We have received many applications in the previous few weeks regarding on-lot septics. On May 4th, we began work on trapping mosquitoes and deer ticks to be tested for West Nile and Lyme disease, respectively. As we continue our transition to resuming normal operations, it is important that we maintain a balance between normal operations and continued COVID-19 mitigation efforts. We have received some applications to open new establishments, including restaurants and retail stores. We are currently in the process of coming up with a safety protocol to make sure that our inspectors are safe when inspections resume. Our initial focus will be catching up and reviewing the backlog of these applications, and at the same time resuming inspections of campgrounds, mobile home parks, and large retail stores. Many people have asked questions regarding the annual license fees. We have submitted an ordinance to be reviewed by County Council in order to help local businesses struggling due to the hardships of the COVID-19 pandemic. This ordinance will, 1, temporarily lift the late fee payment and also postpone the payment of annual license fees through July 31st for food establishments, organized camps and campgrounds, public pools, mobile home parks, and body art establishments. If a business will not operate, and the second part of this is if a business will not operate in 2020, the health department will temporarily suspend their annual license until January 1st, 2021. A letter must be submitted to the health department stating this intent. Again, this will be reviewed by the county council. We hope this will ease some of the financial hardships many businesses are facing. We are also in the process of collaborating with a local company called City Grows to develop an online platform in which restaurants could submit their reopening plans that would occur under the green phase. As mentioned before, we do not know when Erie County is scheduled to transition to the green phase. This collaboration would make it easier for the health department to review these plans and be available for the public to access so they can make informed decisions on which restaurants to dine at when this option is available. Again, this is in development and we will announce it when it is available. Lastly, I want to thank all the businesses who are following the CDC and health department guidelines. You are helping us by keeping your staff and patrons safe. You are one of the main reasons that our COVID-19 cases have remained low in Erie County. So, thank you.
Thank you, David, and thank you to you and your entire team. As you can hear, they have a lot of work they do on a normal basis, and now we've added in the work for COVID-19. So David and his team have been there as a business partner throughout this entire time, helping our businesses follow the guidance and, again, keep their employees safe as well as their customers. So now I'm going to open it up for questions either for David or myself, and today we'll start with Talk Erie.
Yes, good afternoon, Kathy. It's Joel Natale. The state health department has released the names of the 4 long-term care facilities that have had COVID-19 cases, but they redacted the number of cases because it's too small. The number of COVID-19 cases are under 5 for either the residents or the workers. But doesn't the state action kind of reinforce the argument that you should reveal the location of any business with a substantial outbreak of COVID-19?
Well, as you can see, the state has made that decision today to release those names. Those cases, as far as I can recall, are all from a long time ago in this history of COVID-19. And so, they've released those facilities' names, but the individuals most likely have fully recovered, whether it be an employee or a resident, or as it was mentioned in that new release, there is a death associated with one. And so there is no risk inherent to that facility any more than there is a risk of me when I go into the grocery store potentially later today. And so those risks are always out there for all of us. And as I said from the beginning, no matter where you live, no matter where you shop, no matter where you might work, you are always at risk of picking up COVID-19 when you leave your home.
So you still take the stance that it's not necessary to report on any specific outbreaks in operating businesses?
If there is an outbreak that we feel brings a public health risk that is much greater or even greater than going to any other place that anyone here would go to, potentially any single day of their week, then we would certainly make that decision if we felt that there was a higher risk level and something that should be reported to the public. Our main goal is to keep the public safe, to keep the public healthy. That's what public health is all about. And we have been doing that. We've been doing that very well, I would say, in Erie County, particularly when you look at our numbers. And we've been doing it well by contact tracing, by getting the people who are connected to that individual who is positive, who really do have the potential, very high potential, of coming down with COVID-19, getting those people quarantined so they're not out in our community potentially spreading it unbeknownst to themselves prior to coming down with symptoms. Those are the things that we know work. Wearing a mask works. Staying 6 feet apart from people works. Washing your hands work. Those are the things that actually work. And so we're concentrating on the things that we know work, getting our businesses to work well with us and put up as many safeguards as they can so that you can go out and grocery shop or shop for other things or do the work that we all need to do every day. So those are the things that truly work, and that's what we're going to continue to focus on.
Thank you.
Sure. Erie News Now.
A question for you following up on that. Can you give me an example of something where you would look at it and say this is a big enough risk where we would need to alert the community as opposed to something that you deem not a big enough risk? Just wondering what sort of factors you look at into making a decision like that.
Well, it would have to be data-driven, and we would have to truly believe that there is an uncontrolled spread of that COVID-19, and we don't have our hands around it. We don't know where it's going. And so far, because of our contact tracing, we've been able to really keep a good handle on the spread of COVID-19 in Erie County. And again, we are so fortunate to have a health department when you realize that 57 counties in Pennsylvania out of the 67 don't have the ability to do what Erie County has had the ability to do all this time. It makes a big difference. And so we'd have to really have the data behind that, and I can't give you a specific example right now, but I can tell you that the goal of the public health professionals who work for us every single day, and myself as your county executive, is to keep every one of our residents as safe as we can. And so we believe that we are continuing to do that, and we will continue to make the information available that is going to protect people, and the information that will help people stay safer and to avoid contracting COVID-19. And so we'll continue to do that, and if we feel that there's something in danger that we need to tell people about, we will. Jet TV.
Yes, hi Kathy, it's Samir. So I want to circle back around to the restaurant cafe that opened in Corey, and they're now closed. But I wanted to get your thoughts on this. Do you think there's a safe way that we could open, I guess, dine-in services at all? I know, of course, that's against the governor's orders right now, but is there a way to safely do that in the yellow phase, do you think?
I don't think it's not going to happen in the yellow phase. That's a given. Unless something changes down in Harrisburg, it's not going to happen until we move to the green phase.
Right, but I'm asking, do you think there's a safe way to do it?
As I said, when we talked about the businesses opening, there's no business that's I can't say a business is safe. When we get to a point in green, and if they open up restaurants to eat inside, you still are going to have a risk of contracting COVID-19 when you go there, just as you do when you go into any place, whether it be a big box store or a small, neighborhood store. You have a chance of getting the virus, and you will have that if you go out to eat, if that's allowed at some point, and which I assume at some point it will be. You're still going to have that chance, and so we're going to do everything we can to help businesses do what they need to do to stop that from becoming a huge issue in our community. But people will go out to restaurants, and I'm sure somewhere along the way there will be some spread of the disease from someone to another person. It's one person to another, and the more you're around other people, the more that potential can happen. And the longer you're inside of a building, inside of a room, inside of a space where there is COVID-19 potentially floating in the air, the more of a chance you have of taking that in and having the virus find its next home inside of you. So those are the things we know are true, and the more you can stay away from other people, the more you can stay outside and not inside of a building, the more you can stay at home, the safer you're going to be. And that is the fact of this virus. Go ahead.
Just a really quick follow-up. Then do you think keeping, I guess, hair salons closed and then dine-in services at restaurants closed, do you think we're kind of dropping the ball in Erie's economy by having our borders like Ohio who have opened up those services?
I'm not going to make a call on that. This is the judgment call coming from Harrisburg, from our governor, from the Department of Health, from the people who have the data, who have the expertise, who have the knowledge on that. We will move to the green phase when the state decides that is the best thing, or that is the next place to go in Pennsylvania. I mean, it is a balance between our economy and the health and the life of our residents. And so that is a balance that's very, very difficult. And whether you're on the local level, whether you're on the state level, or on the federal level, those decisions are very, very difficult decisions for anyone making those decisions, as we're talking really life and death decisions.
Thanks.
Sure. Erie Times News.
Yes, Kathy, it's David. The death associated with nursing homes, is that fourth death that we were talking about yesterday that the state had reported?
No, it's not. It was an early death, and but we don't know anything about that fourth death. We know it's not one of our 145 that we count. So we still haven't been able to clear that up as to where that death landed in our numbers. It could potentially be somebody who died elsewhere, but their permanent residence is Erie County. We don't know anything about that fourth person.
Okay, but you're saying the one at the nursing home was an early death. It was one of the previous three that has been reported in Erie County.
Yes, it was an early death. Mm-hmm. Yeah. Okay,
and then this question is both for you and for David. When going out to the businesses, we've been hearing reports. Of course, we knew about the Corey, the eatery in Corey with the sign, not having masks. But we're hearing about other businesses have signs that masks aren't required. What happens when the environmental health team goes to one of those places? I mean, from what I understand, masks are required, both customers and employees at these places, correct? No matter what a sign may say on the storefront.
Well, that is the guidelines we have from the state, and that's what we've told all businesses, but I'll let David answer the other part of your question.
Yes, that is correct. Masks are required to enter into an establishments for both the customers and the employees, barring a medical condition. And if someone were to have a medical condition, that store should try to be accommodating for that person. For example, shop for them, bring their goods to the curb, don't have them enter the store, just to make everyone feel safe. Speaking to many businesses, they just don't want we've been talking back and forth. They don't want confrontation, and some have said if someone enters the store, that they should not allow them to enter the store. However, if you allow someone into the store without a mask, that has the potential to start even more confrontation and make some of the other customers mad. So it's give or take either way. But the requirements are pretty clear. Masks are required for both the patrons of the store and the people working at the store.
And David, just to follow up on that, how widespread of a problem has this been that there have been places in Erie County that have not required masks or have posted signs that say masks aren't required? Is it just a few, or has it been a little bit more common than that?
It's been few. We've done some surveillance throughout the county, and I believe it's over a 94% of customers going into stores are wearing masks. Some places are doing better than others, but for the most part throughout the county, everyone's doing a good job wearing the masks, and it's both by the customers and the people working at the store.
Thank you.
So WQLN kind of opened back up for their employees and to the public this week, and I have to say they have a nice big sign right on their front door that masks are not just suggested, masks are required here. So I thank them. It's a new sign that I saw coming up this week, as before that it was basically just myself and Mark, the interpreter, coming into QLN. So now everyone knows they must wear a mask just as we have every day coming in here. Talk Erie. Talk Erie, are you with us? Okay, how about Erie News Now?
Hi, a question for you going into the weekend. Obviously, the county has no purview over churches whatsoever, but is there any fear that as churches start to ease back into this thing a little bit, that even if they're practicing social distancing, if they're encouraging people to wear masks, just having them in a contained space for that sort of time could cause a little bit of a spike?
Well, certainly when people come together, and of course there shouldn't be any more than 25 people coming together. Most churches have more than that number of congregants coming together, but again, it's up to the church what they do. We really recommend that they do not gather yet, and of course social distancing and masks need to happen. But we do know when you come together with those that you share faith with and celebrate that faith, there tends to be it tends to be a close-knit community, handshaking, hugging, just glad to see each other. Those are the kind of things that could be much more dangerous than just maybe when you're passing a stranger in the middle of the grocery store, for example. So those are the kind of things that we worry about. Singing, we know, is particularly dangerous because if you have the virus, it just spreads that much further as you project out. Of course, you could be wearing a mask, but it might be a little more difficult to sing with your mask on, so will people keep the mask on? Will they take them off? Those are all the unknowns, and so those are the concerns we have, as well as we know many people who are older and more at risk are also many of the congregants in our different faith expressions. So it is a risk that any pastor, any church who begins having in-house celebrations, again, of their faith will have to understand going forward, and we ask them to consider that as they're thinking about what they're going to do. Jet TV.
I do not have a question at this time.
Okay. Erie Times News.
Yes, well, first of all, did Joel get back on? I'd give him back his spot if he came back on.
He's right after you, so I'm going to go to him in a minute here if he is.
Okay.
I'll let him ask a couple.
All right. With churches, I want to follow up on that. Have you gotten many reports, since the county can only recommend that churches don't have more than 25 folks? Have you had many reports of churches opening for services with more than 25 people?
I haven't had any reports of any churches opening yet. I actually have a conversation with a number of faith leaders tonight. I have seen that the bishop of the Catholic Church is going to have a town hall on Thursday evening, I believe. So it'll be interesting to hear what Bishop Persico has to say about that faith expression. But Again, churches, because of the separation of church and state, can do what they want to do, but I think many of them, very rightfully so, decided not to hold services during this time. So we don't have any knowledge of any churches opening yet.
Okay, and following up on that, are you surprised a little bit that, you know, with it, that it can only be a recommendation that some churches haven't opened up and started to have services?
I'm actually not surprised at all because, of course, you know, your faith leaders, one of the first things on their mind is your health, your welfare, you know, both spiritually, physically, mentally, and I think they all know that the danger to you physically is quite present when they bring everyone together. So I think rightfully so, they have erred on the side of extreme caution, and they haven't had services since the beginning.
Thank you.
Sure. Talk Erie. Are you with us, Joel?
Yes. Can you hear me now, Kathy?
I can hear you just fine. Mm-hmm.
All right. Just a couple questions for David, if I could. I wanted to ask David, when you're not dealing with COVID-19 on a typical year, what kind of epidemics, especially things that would be going through community spread, would you be tracking?
Mostly things related to, in the environmental division, would be harmful algal blooms and E. coli outbreaks at Presque Isle. Foodborne outbreaks are the big one that we try to keep under control. But those are the main ones. There's not too many, in a normal year, there's not too many outbreaks. The one that we are most concerned about is the foodborne outbreak, the harmful algal blooms, and the E. coli outbreak at Presque Isle. And there's a lot of different factors that go into the harmful algal blooms and the E. coli. We can control some of them and others we can't, but those are the main ones that we try to control in a normal year.
And just a real quick follow-up. I wanted to know how the food trucks were doing. Again, with all of the festivals being canceled, are you seeing less applications for renewal of a food license in that realm?
We have about 10 to 15 food trucks who we've contacted all the food trucks and have required them to submit to the department a protocol for how they plan to operate safely, and about 10 to 15 have done so. With the weather getting nicer, I'm sure there's going to be a few more that want to open up, and if they have the annual license, they can do so. They just need to submit an application to the department for us to review. But so far, we've reached out to all of them, and we're planning on reaching out to them again just to say, hey, are you planning on opening up this summer? What's your plans? If you do, please submit a plan to the department to open up.
Thanks so much.
Here, Erie News Now, do you have any last question?
I do, thanks. Just one for you. Are you relatively excited or optimistic about what we've seen here numbers-wise? Again, 13 yesterday, but that was over 3 days, then just 2 today. We really haven't seen anything egregious in the yellow phase at all. In fact, numbers more or less, maybe just slightly higher than what we had in the red. Does that inspire some optimism?
Well, you know, I feel better about it than I did maybe a week ago when we had those couple days of high numbers. You know, maybe it's more than a week ago now. So it's good to see lower days, of course, and I really believe from what I see, people are trying their best. The businesses, I have to just start right there, our businesses really are trying their best to stick with the guidelines, knowing sometimes how difficult it is for them financially to do that, and of course even just to do it, period. But they're trying their best to keep everyone safe. The last thing they want is to have any kind of a issue associated with their business in terms of somebody getting sick from COVID-19. But as we know, people don't even know that they have it, and they could be spreading it without their knowledge. So again, we have to protect ourselves and protect others with our masks and our 6-foot distance. So I want to start with the businesses, and we want to thank them for all that they're doing. And then I want to thank all the people. You know, the vast majority of people, as David mentioned, 94% are wearing masks when they go into a store, and hopefully keeping it on. I have heard a few, you know, just reports from people who say they go into a store, and like a big store, and as they're walking around, they see people with their masks down around their neck. And we ask everyone to just please keep your mask on while you're in the store. door until you leave there and get in your car. So, but people for the most part, I think, are doing what we have asked them to do. People want to keep themselves safe and keep each other safe. So I'm optimistic that this community is continuing to rise to the occasion and helping us to do well in yellow, so that once the green guidelines are brought out, we can be one of those counties that would then move on to green. So yeah, I'm an optimistic person anyway, and I really believe in this community and the people in it. Jet, do you have any last questions?
I do not.
Okay. How about Erie Times News? David, do you have any last question?
Yes, Kat, I want to talk a little bit more about your meeting tonight with the faith leaders. What do you expect to happen after tonight's meeting? Do you think there might be a timetable for services to start?
No, this meeting is really, I think, more about just having a conversation and for them to hear from me and you know what I believe is happening in the county and just the guidelines that we've gotten from the state, and to make sure that they all are aware of where they can find the guidelines, and as they make their own decisions, that they are well informed. So I don't know that there'll be any decisions made while we're on this call, but I'm always available for any group who wants to speak and wants me to speak to them, or any of my employees like David on here. He's been on some calls this week with me, with others, and so we want to be that partner out there with our nonprofits, our faith groups, our businesses, and so that's what tonight is about. It's just for me to have a conversation with these faith leaders and to help them as they're trying to figure out where they're going.
And then to follow up on a different subject, Governor Wolf today vetoed a bill that would have given counties the ability to develop and implement their own mitigation plans. I wanted to get your thoughts on that.
Well, I mean, honestly, 57 counties, actually, you can add 4 more because those 4 other health departments are in cities, they're not in the counties. So 61 counties don't have the expertise that we have in Erie County. So the vast majority of counties don't have that ability, and I can very much understand why the governor would want to do that. Plus, we are one state, and we should be a united front in how we do things. And our Department of Health at the state level has a lot of very talented, skilled, educated scientists and people who can help make these decisions for our community as a whole, as the Commonwealth of Pennsylvania. So I understand his concern with allowing something like that to go forward. And you know, we all need to have our voices heard, our local voices heard on the state level. And I think that the state has done better with that and listening to us, local elected officials and others. But I do know that, again, we have a real advantage here in Erie County that most counties don't have, and that would put them in maybe a more risky position.
And nothing new to report as far as details on entering the green phase since we talked yesterday?
No, nothing new. I wish I had something new to report to you. I mean, I want to know, as well as everybody else does, what does a green phase look like? Because I think if we know what that is, that gives us something to shoot for, right? Right now we don't know what we're trying to achieve, what we're trying to strive for. And so I have continually said, you know, we need some guidance here. We had some minor guidance about the yellow phase early on, so we knew sort of what we were shooting for, but we haven't gotten anything on the green yet, and I'm anxious, as everyone else is, to see what that looks like. And Talk Erie, I'm going to come back to you since we missed you on that one round. Do you have any last question?
No, thank you, ma'am. Appreciate it.
Sure. Well, David, George, thank you for being with me. I appreciate his and his team's work. As always, they do a great job every day, but especially now during the COVID-19 pandemic. And I thank all of you again for being with me on this beautiful Erie County day. And in the meantime, please stay close as home as you can. Please stay safe wherever you are, and please always stay calm. Thank you.
And you've been watching today's update on COVID-19 from County Executive Kathy Dahlkemper. In case you just missed it, here are some of the highlights of the update. Kathy Dahlkemper clearly touting the ability of our Erie County Health Department and the fact that Erie County has a health department as one of the reasons why our numbers are remaining quite low. She said that they are making the difference in keeping residents safe and COVID-19 under control. She was asked about those 4 long-term healthcare facilities that were reported by the Commonwealth as places that had cases. She said she will still not name the location of a business unless it is a higher risk to the public. But their main goal, the counties and the county health department, is to keep the public safe. And if it's data-driven, an uncontrollable spread, that they would announce it, but that hasn't happened yet. Also today, she was talking about a meeting tonight that she's going to have with faith leaders, conversation about what's going on in the community, reiterating the guidelines produced by the Commonwealth in terms of them holding services or what it's going to look like when they are able to. Also, too, that fourth death we've heard about that the Commonwealth is saying happened in Erie County. She said that it's not accounted for yet. It's still being reported by Pennsylvania, but it's likely maybe someone who passed away from COVID-19 outside of Erie County, but it was listed that their residence was Erie County because that's how they are reporting them. The numbers today, though, too, more good news, I guess you could say. Only 2 more confirmed cases of COVID-19, bringing the total to 145 in Erie County. Of those 2 new cases, one is in their 20s, one in their 50s, and out of the 145 confirmed cases, 120 have recovered. Crawford County still reporting 21 cases, Warren County 2 cases. There are 53 confirmed cases and 4 deaths reported in Chautauqua County, New York, and 232 confirmed cases in Ashtabula County, Ohio, with 26 deaths. Here are the latest numbers from the Commonwealth. Today, 610 additional positive cases reported of COVID-19. That brings the total number of positive cases statewide to more than 63,000. In addition, there were 119 new deaths reported, bringing that total number of statewide deaths to more than 4,600. More than 285,000 people, though, however, have tested negative. And the best advice we remind you daily, stay safe, is to stay calm, stay home, wash your hands often, practice social distancing of at least 6 feet, and wear a mask. Statewide virtual town hall meeting on the coronavirus pandemic can be seen Wednesday night at 7 p.m. right here on Jet 24. The telecast will feature state and federal leaders discussing Pennsylvania's response to the COVID-19 outbreak and the state's Move Forward plan. Guests will include State Health Secretary Dr. Rachel Levine, U.S. Senator Bob Casey, the Pennsylvania Emergency Management Director, the Secretary of Agriculture, and the President of the Pennsylvania Chamber of Commerce. And we want you to have an opportunity to submit questions for this virtual town hall. Details are posted on our website at yourerie.com. And you can join us Wednesday at 7 p.m. as Jet 24 in Harrisburg. Again, as we just said, they have that coronavirus special. We'll also have a complete wrap-up tonight on Jet 24 beginning at 5 p.m. and we're live every night at 7 p.m. on Facebook as well. Thank you so much for joining us. Have a great afternoon.
This has been a Jet 24 Fox 66 special report. For ongoing developments, log on to yourerie.com. We now return you to your regularly scheduled program.